helping. Again, we did a lot in terms of dentistry, but the trick that really helped the longevity of the results is the therapist helping me. Because if not that, I don't go home with them. I just tell them, please do this. And then I expect them to come back to me in 1 month, 3 months, 6 months with the results. She helps me guarantee them.
Welcome back to the podcast. Today we are diving into a topic that is so close to our hearts here at Enara, creating a world where every single child feels seen, supported, and safe. And our guest today is doing exactly that, one smile at a time. Dr. Yasmin Kottait is a pediatric dentist based right here in Dubai, known not just for her incredible expertise, but for her deeply rooted passion for inclusion. At her clinic, every child, regardless of their abilities or special needs, is welcomed with her open arms. Today, we are going to talk about breaking down barriers to healthcare, managing sensory sensitivities, and how the right tools can make a massive difference for families. Dr. Yasmin, thank you so much for being here today. And I have a few questions to go through with you. Are you ready?
I am. Thank you, Zoya,
thank you
for
so
your
much.
invite. And thanks for Enara. I love the mission, which is exactly the mission I'm on. Making kids be seen, heard, and understood. It's all about understanding those lovely, lovely kids.
Thank you so much for being here with us today.
Pleasure.
The one thing I really admire about your clinic is that every child is welcome, right?
Yes.
Inclusion is clearly something you care deeply about. What is the important to you, and how do you make sure children with autism and other special needs feel comfortable when they visit you?
Great question, Zoya. I love your question. Now, remember, children on the autism spectrum and children with special or people of determination, every child is different.
Sure.
So it is a tough task to be able to accommodate them and make them feel welcoming. Now, as everyone knows, the dental area is not one of the best. Nobody wants to be there, including myself sometimes. And, the dental treatment is all about sounds, which, are sound sensitivities on the other side on children with special needs or people of determination.
Right.
Also, tastes, textures.
Sure.
So the dental treatment in general are all about the sensitivities that our children are experiencing. So how do you balance that?
Yeah.
And dental treatment is invasive. It has to be invasive.
Of course.
So it is. So the conclusion is it is not easy. But with a few, psychologically slash OT slash ABA therapy techniques, you understand to make them feel welcome. To give them an intro to the environment before, to take the unfamiliar to the familiar, to know when to back off, to know when to approach, to know when to touch, to know when not to touch, and to know how to get them there that they accept you. You're a complete stranger as a dentist.
True.
And then to accept the chair, which is full of movements and jerky movements and things like that. And then to accept your sounds, which is nobody likes. And then to accept the taste, which you will enforce at the mouth.
Of
and
course.
It is a journey. It is a journey.
It's a challenge.
It is. It's one of the biggest challenges. So understanding, preparing the environment, training the team. Okay.
Yeah, that's important.
And praying and hoping for the best.
Yeah, that's for sure.
Because without those prayers, we don't know what is up.
I know, right? And so we know that a trip to the dentist can feel overwhelming for many children, especially those with sensory sensitivities or anxiety. You just mentioned that, right?
Yes.
How do you prepare them for the experience when they come to your clinic? What can parents do before the appointment to help to smooth the process?
That is a very great question, because absolutely, if you bring a child unprepared and you bring the twin of the same child prepared, you will see two completely different experiences.
Absolutely.
So my first biggest recommendation is bring the child with no pain. Bring the child for prevention, bring the child in a good mood, bring the child when you don't need the dentist.
Yes.
That's my top recommendation. Second, before you come to see the dentist, Google, search, how do they look like? What do they talk like? How does their office look like? And it's not a bad idea. Now, on my website, I have a social story. And the social story is very simple. It has me smiling. Okay. And then it says, this is the dentist and this is what you need to do to help the dentist. And at the end of the journey, after helping the dentist, this is the award you get. And you sit on the chair. This is the chair. And the chair might go up, but that's okay.
Yeah.
And the chair might go down, and that's okay. And the dentist might use a mirror and they show the mirror, and this mirror is okay.
Good.
And then, you know, I also have a social story for taking pictures, which I call them cookies. And I'm like, don't eat my cookie. Okay. But then, you know, they kind of get the idea of coming in. How do I look like? How does my room look like? What do they need to do? You know, what do they need to follow? And then what is in it for them, which is their reward. They get that, they come, they take their reward and go. Now, this social story is a great idea if we didn't see the social story, if we didn't follow the social story. Every dentist now has an online presence. We have to show our children who is their dentist going to be, how they look like, how they talk like, how their clinics look like, in terms of videos, just scrolling through the videos. Because again, it's the concept of making unfamiliar to familiar.
Yes.
One last thing, my recommendations to any parent coming with special needs is bring their own brush. And I cannot tell you how many times they, you know, I bring a mirror and they're like, I'm not going to open to that. But I bring their own brush and even mama's hand coming with the brush and then the opening so then I can check the teeth. See?
Yeah.
It doesn't have to always be. So my examination doesn't have to always be on the chair. It could be in the waiting area. It could be while they're standing. It could be wherever they're comfortable. Wherever they're at.
That's important.
I meet them there. I give them the time to, you know, to
get adjusted. Yeah.
Exactly. To experience the environment.
Sure.
And familiar to unfamiliar. Their familiar is their brush. So I use that to introduce the unfamiliar, which is my tool.
Very good. That's a very strong technique, actually. And it's very, very important to prepare them to ease the process, you know.
It works 100% of the time.
Amazing.
100%.
Amazing. And the visuals are actually very, very strong. You know, the social story, as you said, going, looking at your picture is very, very important.
Because kids on the spectrum, as well as neurodivergent, neurotypical kids, all kids are visual creatures.
Yeah, yeah. 100%.
They need to see. They need to understand. And then they choose to follow or not. That's something up to them. But we do our bit, which is show them.
Sure. And they need to be, you know, they like to be prepared what is coming up. So when it's unexpected, it's a lot more difficult versus when they are prepared. So thank you so much. These are amazing tips.
Thank you.
So from your experience, Dr. Yasmin, how important is it for parents, therapists, teachers, and dentists to work together? Have you seen better outcomes when everyone is working together to support the child and the process?
So again, you know, as a dentist, I only see teeth. I only see oral health, right? I have a tunnel vision. But now, for example, an OT therapist, now get me another ABA therapist, now get me a speech therapist, now my functional therapist, we can talk about that later. So, and maybe, you know, a chiropractor or neurodevelopmental chiropractor and all this big circle of people. And now we're talking to each other. Now my tunnel vision is not teeth anymore, right? It can grow to be wider. The entire child. For example, I'm seeing Zayed. Oh, I see entire Zayed. Now I know more about Zayed's, not just Zayed's teeth, but I know more in terms of, Zayed actually has a lot of sensory sensitivities and he does not want to brush his teeth. Now what can I do? You know, so then I'm speaking to his therapist and I say, you know what, he doesn't have, he has a sensory sensitivity, but I recommend an oral electric brush, an electric brush. So can you help me introduce that? And then we're both working for the same goal because we both see Zayed. Not me, Zayed's teeth, not her, Zayed's sensitivity or chewing abilities or things like that. We're all integrated. And I have a little story. Can I share?
Of course.
Okay, so it's a 14-year-old boy
on the
autism spectrum, moderate, nonverbal. It is tough and challenging. Now, thank God, up until that time, all that was happening wasn't any cavities.
Okay.
But someone introduced Nutella to his diet.
All right.
And then he started getting addicted to Nutella. Like the old system of getting kids, rewards by food, which we absolutely should all eliminate.
Mm-hmm.
And then what happened is Zayed now has adult teeth because he's 14.
Yeah.
I'm going to call him Zayed. That's not his real
name.
name.
Yeah, that's fine.
Okay. And then now they're coming to me and he's already starting with cavities.
Cavity, of course.
He doesn't like to brush because he has a lot of sensitivities.
Mm-hmm.
He's 14. He's no longer 5 or 4 or 3.
True.
And then now what we do. So now we do work as a team. And God, please forgive me. I had to introduce the brush with peanut butter. He didn't like peanut butter too much.
Well, it's not as good as Nutella, I would say, isn't it?
So then, please, God, forgive me. I had to introduce a little bit of Nutella with a little peanut butter.
Just like a mixture.
And then we introduced it. So we accepted the sensation of the electric brush. And then we weaned it off. And, Nutella next to toothpaste.
Right.
And then no more Nutella, a lot of toothpaste.
And
then all the cavities that were starting, true story, started reversing. Again, we did a lot in terms of dentistry, but the trick that really helped the longevity of the results is the therapist helping me.
Yeah.
Because if not that, I don't go home with them. I just tell them, please do this. And then I expect them to come back to me in 1 month, 3 months, 6 months with the results.
Yeah.
She helps me guarantee that.
Super. That's so amazing to hear, actually. Yes, that's
But
great.
God forgive me about using that. No, I'll never do it again.
Well, as long as it worked, then sure.
It did.
Okay, let's move on. So technology is becoming a bigger part of our lives every day, right? Do you think it can help children prepare for experience like going to the dentist? Have you used any digital tools or visual support for parents?
So technology is on the rise in a very, very, very scary way. Now everything is AI. People talk AI. People laugh AI. Everything is scripted. Everything is AI.
Yeah.
Now, to be honest, I love AI. I love using AI. And I would like AI to make us more human and make us more time to be ourselves and to be more human rather than be, yes, this is AI, this is automation AI, right. Everything is AI.
Robotic.
Right? Mm-hmm. In terms of AI serving our children on the spectrum or children with special abilities, of course, there is a lot of, a lot of ease that us as
100%,
the dentist, the therapist, the parents, we can get to be like, how can AI serve me this? Creating the social story is so easy now through AI. Creating the journey is so easy, asking AI the right questions. So yes, of course, there is a big part of AI helping us, but we should not forget that AI is not the boss.
Yeah.
We are the boss.
We should be the boss.
Right.
Yeah,
and we see the full thing. And AI is just the tool. It's like my mug here. I have one mug that's white. I have another that's pink. Right?
Yeah.
Pink. But they're both mugs.
True.
That I use whenever
true.
I want. So yeah, and in terms of AI is helping me as a dentist automate a lot of my scripts. It's helping me it's helping me create a lot for the kids that will, it's actually helping me dictate my notes when I need to. So my notes are spot on without me spending an hour into writing my notes like I used to, 6 years ago. I just had to write and then waste all my time writing.
Now, yes. Now it's easy.
Done. Poof.
True. Very true. So as long as it's balanced, I guess that's what it is, right?
Yes, absolutely. As long as it's a resourceful tool.
Yes.
And as long as it's intentional. Like, how can I help this child? Okay, now I get it. But it's not, I'm not going to put a child on a conveyor belt. Every child just gets the same AI, video AI thing.
Yeah.
No.
Yeah, sure. It should be just an enhancement, not the replacement.
Personalized.
Yeah, personalized. That's true. That's a key word. So, doctor, many parents feel guilty about letting their children use technology because they hear so many negative things, right? About the screen time, precisely. Do you think technology is always a bad thing? or it can be a positive tool when it's used in the right way. We were touching on it a little bit, so maybe we should just, go a little bit deeper.
Yeah. And technology, you are going to see one line splitting technology right in the middle. It is bad. Yeah. It's so good. I love it. And to be honest, yes, it is a very thin line where you use it for your benefit, or it becomes addictive. True, against you. So to be very honest, I'm guilty in overusing technology in my office, because what am I trying to do? I'm trying to distract them. So does it have its merit? Absolutely, yes. Right. Can we use it in a better way to teach, to navigate, to enhance, but it should not replace connection. Sure. It should not replace our humanity. Definitely. It should work as a powerful tool. Like, I want to distract, I want to make them at peace. I'll get them this nice blankets, I'll get them the headphones, the sensory blocking headphones. I'll get them this, I'll get them the distraction too, which is technology. Yeah, of course. But I'll still my hand will be there telling them it's okay. My mom, the mama will be there, there will be a hugsy wugsy. I call it a hugsy wugsy, just a bear or something they're hugging. So there will be a lot of that. And technology is right at the center for our kids, whether it's TV, whether it's iPad, whether, PlayStations and Switches, which again, I'm guilty of that. I love it too much. And again, for my own kids, it has to be a balance, whether, we're learning something, whether it's a little bit more mindless, but there is a line where the kid is just living for technology, not doing much, where we are using technology to get to where we want. Yeah, true. Okay, so looking ahead, how do you think technology and AI can support families and healthcare professionals without actually replacing the human connection that children need? You were also starting to say something about the human touch, which I think is extremely important. Yes. So how do we move forward with this? So great question. The most important is the dentist, the therapist, the parent, with their intention and thinking, what do I want to achieve here? Now, in my clinic, I'm so high about the patient journey. Okay. And to be very honest, it's so hard crafting the patient journey every single day, every single time. Of course. In a very, very, very busy practice that is full of neurotypical, neurodivergent, and parents, and kids that are scared, and kids that are anxious, and kids that are happy, and kids that are excited, and the little ones and the big ones, and so difficult. So much, but again, AI can help us keep our eyes open on the big picture. What do I want delivered? I want kids to be seen, understood, happy. It's hard to be happy most of the time leaving the dentist, but it is doing your best to kind of deliver that happiness. Exactly, to them. And it is achievable, and it goes up and down. Right. So the patient journey could be dictated by AI. That's something definitely. The patient education could be dictated by AI, and I'm working on a few projects I'll not tell you about just yet. Okay, you will find out. You will see. Good. Yeah, they're excited. I'm so excited. Oh. I look excited. Let us know once it's done. I will. And so things like this, AI is perfect at, because you can give it like, this is what I want. This is the aim that I want. The big question I'm thinking is this: how can you help me get from here to here? And keep applying that. Also, the social story that we spoke about, AI could do that. AI could do a lot more for us. And when it comes for parents, parents would have a lot of questions. AI, from the website, AI could be like, take this information from this. As soon as a patient says this keyword, take it and just use it and whatever. So it will help the parent understand more about us and what we need and what we need from them. Super easy, rather than a human saying, oh, this is, special needs? What the doctor means that?
Yeah,
Says we
yeah,
not
yeah,
gonna have
sure.
to do this.
The clarity is very, very important for parents as well,
Yes.
you know,
Yeah.
and then they are also part of this journey. It's not just you, it's not
Yeah.
just the child, it's all of you together, right?
Absolutely. What a big
So
team.
especially in that moment when you're working on the teeth of the
Right.
child. So yeah, it's very
Which is
important. And
difficult.
thank you so much for highlighting
Yes.
the importance of AI,
Yes.
as long as it's done in a right way, in a
Right.
balanced way, right?
Right.
Before we finish, Dr. Yasmin, my last question: what is one piece of advice you would like every parent of a child with special needs to take away from this conversation?
Okay, I love this question very much. Now, I will step back a little bit, step into being a dentist for kids again. And I would say, now, my biggest recommendation for a parent with a child on the spectrum or special needs is bring them before there is anything. Bring them as soon as you receive a diagnosis. Make them have a dentist as a best friend for life.
Super.
The earlier you start with them knowing who's the dentist and what they do, and they don't have any pain, and the dentist will give you all the prevention techniques.
Sure.
The best thing you can do for your child is not need the dentist. That's the best thing you can do.
True.
And you get them to brush their teeth, because the dentist will give you all the tools you need to keep those teeth happy. And and kids grow. So by seeing each other frequently, it will help the kids be familiar. There'll be no tantrums, there'll be no traumas. And if that is not the case anymore, we had seen a dentist and it didn't go that nicely, it's okay. Keep trying. There are a lot of dentists with special needs education that are out there. We just have to be, we have to be a bit aware that this is a special certification. And there are pediatric dentists with that special certification. Again, we prepare the child. We prepare the dentist. That's not a bad idea to say, my child has seen a dentist and this has happened. How can you help me?
Yeah, of course.
Based on that answer, you will know whether the dentist can help you or not.
Of course.
And also, of course, prioritizing healthcare, dental healthcare. Just like we prioritize hand washing, face washing, going to school, dentistry is up there. The more we prioritize it, the less it becomes of an issue. And the more it becomes automation. It just becomes automation.
Of course.
One of my top recommendations is no food for awards, please.
Okay.
Only, fidgety things, sensory things,
something that's
psychological things that are awards. No more food. I know this was old school and a lot are still using it. And I have so many patients, and I can tell you what's their age, what's their name, that I worked so hard on changing that. And thankfully, I have a lot of success stories. And unfortunately, I do have a lot of not success stories that are still progress stories that I would like to,
as long as they're in the
progress. I didn't get there yet, because that is what
but
life
it takes
is.
time. It's very individualized.
Right. And one of my recommendations is some parents tell me, you know what, I feared coming here till this is here where I am now. And I would tell them, there's no need to fear. And, if you see a dentist and they're not right fit, just keep trying. It's okay. Of course. Just keep trying. And my last recommendation, I have so many recommendations.
That's fine.
My last recommendation is, wait, let me think. I lost my last recommendation. My last recommendation is, of course, we use AI to be more human, to be more available, to be more connected, to be more present.
Very good.
Not be distracted, not use it as, let's just do this.
And to disappear.
Exactly. Being more of us for them, being more a better version of ourselves for our kids, whether we're parents, we're dentists, we're therapists, whoever we are at the world, we can be more us, more human.
Yeah, that's amazing. Thank you so much, Dr. Yasmin, for being with us today.
It's my lovely
pleasure.
Thanks for your invite.
Sure, you're very welcome, and we'll hope to see you again.
Thank you.
What an incredible note to end on, Dr. Yasmin. And thank you so much for sharing your time, your heart, and your invaluable insight with us today. You have given us all so much you think about regarding how we can lead empathy, collaborate as a community, and use the tools around us to advocate for our children. For everyone listening, you can follow Dr. Yasmin's wonderful work and find more of her brilliant tips on Instagram. Thank you all for tuning in into the Enara podcast, where we truly believe in early support for every child. Don't forget to subscribe, leave a review, and share the episode with a parent, therapist, or educator who needs to hear it. Until next time, take care. Parents, you are not alone.